Hey everyone, it's Michael here at Home Health Success Academy, and you are watching the Home Health Fraud video series where we share with you guys some truths about how a lot of people are committing fraud in the home health, the hospice, and home care industry. So in this video, what we want to be able to talk about is how home health agencies commit fraud through billing. Okay, now this pretty much talks about home health agencies that provides medical services, that bills Medicare or private insurances or Medicaid. And so a lot of things that we share with you guys are stuff that you can actually look up in Google and see how specific companies are doing it. So in this video, we're talking about billing. And so how do home health agencies commit fraud through billing? Okay, so in our industry, if we admit a patient and we have the doctor's orders and the patient qualifies for home health services, there are some companies out there, unfortunately, some home health agencies out there. What they do is they commit fraud through billing. And how they do this is they do what we call upcoding, where they actually fraudulently put information in the patient's chart that causes the patient's the charges for that patient to actually go up, whether we're saying that the patient needs therapy services when the patient really doesn't, okay? Or there's certain diagnoses that they actually add to give reasons why they can bill more. And the fraud is committed by several people, and some people are either guilty or not guilty, meaning there are billers out there who will bill for a home health agency, and of course they get paid depending on how they're able to bill for the patient and how lucrative it could be for the home health agencies, okay? And so a lot of owners over there who unfortunately are not aware about the billing situation and how to bill, these billers that work for them will either upcode or make sure that they bill fraudulently so that the owners are happy and they keep their jobs, okay? And so that can be problematic. Now, of course, there are some owners out there who have been proven guilty for upcoding and billing problems, and so they facilitated the whole fraud of the whole thing, where they make sure that the biller bills for particular patients, okay? And so it can go either or, and it's in a matter of who really is doing it and what's really occurring. It's up to, of course, the OIG to be able to look into that if a facility is caught. And so these are things that you have to be mindful working for a company to see, hey, you know what, I'm trying to see some discrepancies here, and do you really want to work for a company that's committing fraud? Okay. When I started talking about creating this video series, a lot of people actually asked me, I said, do you really want to expose that? And what I said was, it's already out there. It's already occurring. The OIG is doing it for us by letting people know which agencies have been found guilty or who have been charged. And so it's me just sharing information with you guys so that you guys are aware of what's going on. So let's say, for example, you're an owner, an administrator of a home health agency. You should be knowledgeable about how the billing process occurs. Not just seeing that report of how much came in, but making sure, hey, did the patient actually qualify for these services? Or does the patient really have this diagnosis? And so it's a matter of us being accountable and making sure that we're fully trained. Okay, so that's one thing that you guys should actually do out there, is make sure you know everything that's going on. If you're an owner of an agency, you must know how to market. You must know how to bill. You must know how to be able to do quality assurances, right? Before you can actually lead a team correctly, you must know what each individual team member can do and should do. That doesn't mean that you should be the best at it. You just should make sure that you know what's going on. So that is one way that a lot of agencies have been caught out there to actually commit fraud in this home health industry, and that's through billing. I hope this information, is something that is valuable to you guys, obviously. And if you guys want more information like this, please let us know. My name is Michael with Home Health Success Academy and 10xpatientreferrals.com. If there's any other question, we want to answer that. Always know that home health marketing is easy when you guys know what you're doing.